Hello, fabulous YouTubers out there. Thank you for joining me today. I'm going to be talking about one of the most common problems that lots of people have in the world is headaches. There's all sorts of variety and kinds of headaches and how they feel and how they impact your life, and luckily, things that we can do about them. So let's talk about those today. We generally divide headaches into three big categories right there: tension type headaches, migraine headaches, and cluster headaches. There's obviously other things that can cause headaches too, and sometimes those are more worrisome, sometimes not quite so worrisome, but definitely things to know. Things right off the top of my head that are bad, that are red flags that show that we probably need to go to maybe an ER for evaluation. If you suddenly get a headache that's just the worst headache of your life out of nowhere, that's a problem. That makes me nervous. Or if it's you're over 50 years old and you've never really had headaches before, and all of a sudden you get new headaches. These are different than anything you've had before. That's worrisome. Obviously, if you're having stroke symptoms, drooping on one side of your face, weakness on one side of the body, trouble speaking, that's a reason to go to the ER seeking urgent care, urgent imaging. Um, in general, sudden onset or headaches that get worse with sexual activity or come on suddenly during sexual activity or with exertion in general are more worrisome. And if you've got a fever, if you're having a lot of neck pain, trouble touching your chin to your chest, get a little bit nervous about meningitis. So those would be all reasons to consider going to the ER. But if these are just your normal headaches you've had for a long time, you keep having them, and maybe you're having trouble finding something that works for you, let's talk about what options are out there. So to tease out what kind of headache that you might be having, tension headaches in general are ones that wrap around your head all the way. They might feel better if you rub your temples or above your temples. You've got this big muscle called the masseter right here that helps you to chew. Tension headaches are often related to grinding your teeth at night, or maybe some tension in your neck, tension in your shoulders when you're really stressed out. Um, and they often are described as like a squeezing pressure around your head. And they're something that I've had for most of my life. I remember growing up and having them every day. They were getting in the way of my life. I wasn't able, as an elementary or middle school kid, to go many days without having to take an ibuprofen. So it was a real problem. And something that I found that was just phenomenal is my parents found a psychologist that did what's called biofeedback. So that's one of my favorite things. It's just can be hard to find someone who does this. So what they did is they attached little sticky strips across my forehead where I tend to tense my jaw and tense my face when I'm stressed out. And they hook it up to a little machine that makes a noise, and the noise correlates with how tense these muscles are. So what it was is it was teaching me how to tense and relax those muscles so that I can be more conscious, more aware of when I'm letting my stress get to me and tensing those muscles, which cause me to have a headache. So it released a higher pitch, for example, when they were more tense, and lower pitched when they were relaxed, so that I could slowly learn over time, over many sessions, how to relax those. So I know a lot of people give me the side eye if I recommend that they see a psychologist or a therapist for something like a headache. But honestly, it's one of my favorite things out there. I mean, what a bonus it's been to me for the rest of my life that I have that new skill of how to relax those muscles, how to relax myself to stop headaches from coming on in the first place, or to bring my own relief when I'm starting to get a headache. So kind of a tangent there about tension type headaches. Moving on to migraine headaches, migraines are the ones that tend to be on one side of your face or the other, especially behind your eye is a common complaint. Frequently, they get worse with loud noises, worse with bright lights. Sometimes they're associated with nausea or vomiting. They divide them into these classic or common kinds of migraines. It used to be that we thought that migraines were only the kind of headache that you have if sometimes people see little like visual changes before they start having the headache or as it's coming on, sometimes little wavy lines in the corners of their vision. So that's called an aura. And that used to be the way we diagnosed headache migraines, but now we know there's also migraines that don't have that. So that's actually more common to have migraines without an aura. So those are common migraines. And finally, there's cluster headaches. Cluster headaches, oh, they're a rough one to have. They tend to happen in clusters. You tend to have one or two a day for many days at a time, and then get a long break, and then have it happen again. And they are really just disabling headaches. They tend to be on one side of your head. They tend to be so bad they make that one eye cry. You're tearing up on that side. They last for about 15 minutes, sometimes longer, sometimes less, and you can't do anything else. You're pacing the waiting room, waiting to see the doctor. The classic treatment for cluster headaches is actually oxygen therapy. I know there's lots of people out there that haven't gotten full relief with that. Please come and find a doctor who's willing to try other things with you. They're such bad headaches that the depression and suicide rate with people with cluster headaches is alarmingly high. So I urge you to please find a doctor who will try and keep working with you on how to resolve those cluster headaches. But more common headaches, tension and migraines. One of the first things I recommend doing if you've got headaches that are bothering you is to start a journal of some sort. Try to keep track if there's foods or activities in your life that correlate with the onset of these headaches. Sometimes people will find that stress, when they're really stressed, they get a headache, and maybe decreasing that stress is the ultimate way to make these headaches resolve. Finding other ways to cope with stress. There's lots of stressors in our lives these days, but you don't have to internalize that stress. You don't have to respond to it by causing yourself pain. That's a bad response. We don't want you to respond that way every time you're under stress. Stress is a normal and common part of life. And if you're giving yourself a headache, I mean, it not consciously, not purposefully giving yourself a headache, but if that's what's happening, we need to try to figure that out. Like biofeedback. I love biofeedback. We can do something about that. We can retrain your brain so that's not the way you respond to stress, but it does take work. Or figure out that a lot of people find that smoking makes their headaches worse. The more cigarettes they have, the more their headaches come on, the worse they are. That would be something that you could pick up in a journal. Sometimes people who drink coffee or soda every single day and then go without one day will get a bad headache, a caffeine headache. So that would be another thing you could realize from documenting what tends to correlate with your headaches with food intake or activities. Sometimes if people take ibuprofen for something else, or even for their headache every single day, they'll get an even worse headache if they go without an ibuprofen that day. That's called a rebound headache. So that's something to be aware of too. Or sometimes you need to adjust your glasses. You need to get a new set of contacts, update your prescription. So a visit to the eye doctor might be reasonable to do if you're starting to have a headache. Now, if you have a history of a head injury, a concussion type headache from a traumatic brain injury is different and needs to be treated differently. So if that's something that's recent or in a distant history even, sometimes you can have residual headaches if that concussion isn't treated properly. Please go and see your doctor about that because that's a different thing that needs to be treated. So I love biofeedback. Other ways that people have found that are non-pharmacological that can help with headaches, things like yoga, relaxation, counseling in general, figuring out how to better cope with stress in your life, acupuncture, sometimes physical therapy on your neck or your upper neck or even your shoulders can be really helpful for chronic headaches. Something to consider. That doesn't always have to be medications, but medications are awesome too. For really chronic headaches, I really like what's become more common is injections of steroids or Botox or sometimes other medications into the muscles on the back of your head here. These are called occipital muscles. You've got your occiput is your big part of your skull right here that kind of sticks out, and you've got muscles right below it that feel really nice if you massage them. And those can, if they're spasming, they can contribute to headaches. And I love that treatment using Botox into those muscles to kind of paralyze them for a couple months to bring headache relief. It's really neat. What a novel approach. Sometimes the only thing that makes migraines especially better is sleep. So I will treat patients with IV pain medications and give them some Benadryl that knocks them out along with those IV medications, and that's really all that will solve it. So sometimes it's a matter of getting through the day and then getting home so that you can go to sleep, and that's what makes your migraines go away. I know people hate being told to just take an ibuprofen sometimes, but it's really good medication. If you find that ibuprofen just doesn't work for you, there's other medications in that same family called NSAIDs that just tend to work better for some people. Things like meloxicam, Celebrex, naproxen. Those are all possibilities to talk about with your doctor. And Tylenol is, I know people like to bash Tylenol. Tylenol is a really good pain medication for headaches sometimes, so don't knock it till you try it. In general, try to avoid narcotic pain medications or opioids. I mean, for pain in general, chronic pain that you're taking these for on a regular basis, they tend to decrease in effectiveness over time. You take one, and then the next time you have to take two. I mean, it's not that fast, not that drastic, but that is the pattern over time, and they're just not great pain medications. So I really don't like treating headaches with those. But if you've got headaches that are happening every day, every couple days, to the point that you would be willing to take a medication every day to try to prevent them from coming on, that's another possibility with all these kinds of headaches. Sometimes medications used for depression just also seem to prevent headaches from coming on, whether they're tension type or migraine or even cluster type. So things like, they're in categories called SSRIs and TCAs. Those are antidepressants that they've found are also helpful for headaches if you have them that often. You do have to take those every day, but that's a relief if you're taking lots of other medications. Triptans are another medication. It's a family of medications that are used for migraines. Those are more of, you get a headache, take the triptan right away. The earlier you take it is best for preventing that migraine from coming on. But also with migraines, daily medications that they found help to prevent the migraines include beta blockers. Those are medications used to treat blood pressure. So they have the side effects of lowering your blood pressure and lowering your heart rate. But if it helps you with your migraine, sometimes it's definitely worth it. And there's even seizure medications out there that they found help with migraines. So I felt like I went through that kind of fast. Sorry if that was confusing. But mostly I want to let you know that there's lots of options for headaches out there. No matter what kind of headache you have, there are so many things that we can try. And to not give up, keep trying. Think about whether your headaches are coming often enough and are bad enough that you would want a medication that you take every day to try to prevent them, or if you want to stick with just taking a medicine when you start having it. And that there's plenty of changes that everyone can make in their lives to try to prevent at least some of the headaches, whether it's seeing counseling or keeping a diary of what kind of foods and activities make your headaches worse. So hopefully that gets you pointed in the right direction. If you enjoyed this, please subscribe, there we go, to our channel so you can find out what other information I can teach you over the internet about medicine. Always fun. I really enjoy talking about my job. It's wonderful. And if you want to watch another video here, here's another video that you might find interesting. Hope you're having a wonderful day. Take care of yourself.